if you haven't experienced it before, you have to be careful with hitting the wall. When you go through a restrictive diet, like many of you are doing with lifestyle change, sometimes the decrease in caloric intake or carbohydrate intake, essentially the decrease in energy packets that you feed or have ready for your muscles, will be so decreased that you can easily do exercise, push the envelope with your exercise because you want to get an extra 5 minutes of sprinting in or interval training in. You'll want to press a little bit harder on some of your weight training. You're going to outrun your supply and the muscle will seize up. Our muscle will have a severe delayed onset muscle soreness. So one of the things that I tell my patients to temper is the amount of, you usually will have a coach, or I will assume that my patients enlist the help of coaches to answer to. I think it's always important to have somebody to answer to as far as a relaxation practice like meditation or counseling, behavioral therapy, cognitive behavioral therapy. Somebody to answer to as far as nutrition like a registered dietitian, a nutritionist, a life coach, and somebody to answer to as far as an activity like an exercise physiologist, a yoga instructor, tai chi instructor, personal trainer, chiropractor. So it is nice to have those coaches in the field because you won't be able to cheat. You'll actually be able to get good feedback in case you are about to hit the wall and you pull back a little bit. You can get some feedback on what would be a way to get around that hitch or that plateau. So it's always worth the investment. Coming to see me every 3 to 6 months, I can give you a good plan, but to keep the plan in play, you really have to have somebody else that's closely involved with you. So using coaches to get feedback, using coaches, maybe even physical therapists, to help you when you do hit the wall, when you are suffering from the muscle soreness, is important. I leave it up to my patients, as I was alluding to. I leave it up to my patients to kind of figure out if you're going past the 48-hour mark or 72-hour mark as far as suffering from muscle aches and you're still hobbling around, or you can't lift your arm up, or you can't close the door, you can't shift your gears, you can't push the cart, you can't lift your baby. That means, I think, that you're overtraining. I think most people should be able to get rid and kick back into an exercise routine within 48 hours. If you're going for a peak, fine. Like if you're going for your summit, you'll have at least 3 to 4 days, and that's reasonable because you hit your summit. But for your average 3 to 5 days a week workout, even if it's just muscles, what's called a bodybuilding split, where you divide your exercises for upper body or lower body into 2 times a week, I think that you should be able to go right back into it with the same intensity. I do a lot of high intensity strength training or high intensity interval training, and I should be sore enough that I have a little bit of a muscle pump. I always love the muscle feeling of fullness that I used to get with bodybuilding. It's a nice feeling to me. It says I did the right exercise routine, and I think it's kind of invigorating. But if I have muscle soreness and or I can't get to work the next day, or I can't even hold up a stethoscope, or I can't torque somebody's shoulder to see if they have shoulder impingement, that after the second day, that's probably too much. Then I have to rely on Theracanes to help decrease the spasm to muscle spasm in the belly of the muscle. I'll put a link to Theracane use. Or I have to get into magnesium or turmeric, my favorite forms of muscle repair. Sometimes I'll have to go to my Panaway. There's essential oil. It has helichrysum in it, a little bit of wintergreen. This is how I made it through 2 marathons, I think. I was applying this in a little Ziploc bag to my muscles that were sore. It was mostly my lower extremity, sorry. But after a while, my bag was empty. I started licking the bag just to get some of the helichrysum in. Essential oils are fantastic. I love essential oils when you're getting a massage, when you're getting body work, or just when you're doing your own oil massage. Sometimes magnesium in the form of magnesium, zinc, and B6 is also important. So whether you choose regular magnesium calcium or magnesium B6, again, I'll put links to my magnesium suggestions. I think those 2 things help relax muscle. Hands-on healing will help you get past that stick point. There's a kind of a detox that we sometimes do with Ayurveda when you're really sore with muscles, and usually the soreness comes at the insertion point of where the if you have a muscle belly, the muscle usually inserts into one place and originates from another. So the weak part is where the muscle turns into a tendon and where the tendon inserts into bone. That's the weak part. The muscle itself should be okay, unless you suffer from Charlie horse or muscle cramps. And because of the damage that occurs, you have to force a little bit of damage when you're weight training, when you're pushing the envelope, when you're sprinting, when you're trying to go a little extra distance. You're causing an overload to the muscle. And hopefully, if you have the building blocks for muscle repair, the overload will force a repair. The repair will give the muscle more strength for next time. More tensile strength. It'll allow you to tolerate more. You'll have bigger muscle fibers, more mitochondria. So I don't think there's any bad scarring unless you're overtraining, and that's damage. So you have to really temper it. That's why if you're good with exercise on your own and you've tried a couple of different routines since you were in college and high school, it's probably okay. But if you're in your 40s and 50s and you're relying on the old-fashioned stuff that you haven't done in 20 years, your chances for getting into an injury are high because of, number one, the weight you gain between your 40s and your 20s. Number two, the inflexibility that you acquired between your 40s and your 20s. And number three, being stagnant with an 8-hour job where you're sitting like this, your shoulders are usually like this. I usually like to work on shoulder routines. That usually gives you a little bit more of muscle imbalance. And when you have bad posture, muscle imbalance, you're dedicated to 50-hour work weeks for the job that you have at home or the job that you're starting on your own. Exercise is kind of low priority until you have either arthritis start up, back pain that you're suffering from that the Norco doesn't help anymore with, or you have an injury because of walking up and down the steps and getting shin splints from not even exercise. So when you have those kind of things, or maybe even high blood pressure, cholesterol, and diabetes, then somebody tells you get off your ass and you try the old exercises, that might not work. And that's why it's nice to have a coach. Or at least peruse, read different authors, see what's out there as far as Tabata or, again, strength training. Now, P90X seems to be very popular. I like the combination of watching a DVD, having some cardio, and then going into yoga and quieting down. I always think you should balance off muscle strengthening and cardiovascular with relaxation and breath work. It's always important to get all three, especially as you get to your middle ages. So the last thing with hitting the wall is get to know what your tolerance is. Always have building blocks available, meaning mostly clean and green foods. Try to stay away from the crappy foods and the alcohol and the fatty foods or the processed foods during that time that you're rebuilding your muscle. For the first 2 days after a really intense workout, hydrate as best as you can. Stay away from all this stuff because your muscles are still asking. You push the envelope, your muscles are rebuilding, they're getting you set for the next exercise. Don't go eat crappy food. And avoid the alcohol too. Some of my guys will go exercise to get a pump on Friday night so they can go party and look good in their shirts on Friday night. You just screwed up your exercise routine, and it's going to be harder for you to get back in or get the gains on Monday when you go return to the gym. Trust me, you're probably bulletproof at the age of 20, but in your 30s and 40s, you'll be seeing me or my colleagues again. I happen to be integrative medicine, so I have ways around it with acupuncture, yoga, stretching, physical therapy. But if you go see your average orthopedic surgeon, and I love orthopedic surgeons, they're probably going to put you on some big medicines and wait for you to have a surgical reason for them to see you. So be very cautious about when you do hit the wall. Always have a summit available. Just know what to do when you hit the wall. Hopefully that's the only time you hit, and you'll be able to throttle your exercise routine and your endeavors next time so you don't hurt. And then by all means, if you do have a medical chronic condition like chronic fatigue syndrome, fibromyalgia, irritable bowel syndrome, that new concept of systemic exertional intolerance disease, if you have any of that stuff, it's so hard to push yourself. I would always enlist a coach. If you're daring enough, or if you just can't afford a coach, fine, but have the goal set. Know when to pull the trigger and say, this is, or I surrender, no more exercise. Go back to your remedies and your first aid kits. Get hands-on healer involved. and then recuperate, and then plan for the next summit. But I think journaling is always important to know remember exactly what hurt last time, what worked last time to recover quickly, and then keep on chipping away at the iceberg. You'll eventually get it, but bottom line is you can't just rely on sitting back. Even if you have chronic pain or you have a chronic back problem and you're on Norco, you can't just rely on the medicines, and even if you can tolerate the medicines, you can tolerate where you are in life with your disease process or your ache and pain. Those medicines will stay stable. Your body will age, so everything that you relied on to get you through your 30s, even if it worked, you're only going to turn 40, 50, and 60, and guess what? It ain't going to work anymore. You're always going to outrun your medicines. So you always should try your best every year, every 3 months, to get off the medicines if you can, or try to minimize the medicines as much as possible with exercise, good sleep, nutrition, and some spiritual practice. I think it'd be important.